Hi everybody, welcome to week 2 of your health assessment course. Thanks for hanging in there. I'm glad all 4 of you are still here for week 2. You did a really nice job with week 1. You had some good discussion. All of you posted an adequate number of substantive posts, so you're all going to get your participation points. And I like the points that you brought up in your posts. Couple things I just want to make you aware of. Please, when you look at the discussion question, don't just look at the topic. Look at actually what the discussion question is asking you to write about. So for instance, in our second DQ, you were writing about pediatric obesity and how would you get that information or get that topic out to pediatric nurses, something like that. So you all included some really good information about obesity in the pediatric population, maybe how to address it, things like that. But you also needed to really focus in on how you were going to address that specifically with those pediatric nurses, okay? Because that's where that education piece comes in, okay? Like for instance, in the first discussion question, it talked about health promotion and disease prevention. And you guys did a great job of differentiating those terms. But some of you also needed to add a little bit more about how you would actually address that with that student that was concerned about the two terms. Okay? So just pay a little bit more attention to what the final actual question wants you to give. You can give lots of information about the general topic. Just make sure you answer that actual discussion question. Okay? Also, if the discussion questions for a given week, if I don't think they're going to maybe generate enough discussion, or if I think they're not quite hitting the objectives for that week, I might throw out a class question. And this past week under discussion question 1, I put a class question. That was like the title of my post. And if you could try to answer those, that would be great. And if you answer them in a substantive way, they definitely still count for participation points. Really, the only thing that doesn't count for participation points is the prayer forum, or if you don't write a post that's substantive, if you just respond to somebody and say, "Hey, great post," that wouldn't count towards participation points, but the rest of it does. All right, so I hope that helps. So this week, our objectives are focusing on communication, health history, and culture, and kind of the interaction of a lot of those, okay? So first discussion question, we're talking about kind of first impressions and our interpretation of those and what we do with that information. Now, as nurses, we are all trained to eyeball a patient right away. What's their work of breathing? What is their coloring like? Do they appear to be in pain? What's attached to them? We're trained to do that kind of quick look, right? But during the health history, some of our first impressions of a patient's response might require us to dig a little deeper. So we're going to be kind of discussing that area. The second discussion question really talks about understanding cultural norms, having respect for cultural norms. How do we learn about cultural norms? How do we even know we're following or breaking a cultural norm? So hopefully that'll drive some good discussion too. All right, on to the assignment. So when you first look at that assignment, it almost looks like there's 2 separate assignments, like you're going to be turning in 2 different things. It actually is one assignment, but let me explain a little bit how it's all going to come together, okay? So yes, you're going to be interviewing a patient, but who's not a current patient of yours. Remember, family, friend, neighbor, whatever, not current patient. And you are going to be asking them about all those different sections that are spelled out in the assignment. Please use your textbook to look at the content of those different areas, especially when you get down to review of systems. There's some things from your book that you should specifically be asking when you look at those areas, okay? So yes, you are going to be conducting a health history. Now when you go to write your paper, okay, the first section 1 paragraph, 2 paragraphs, but the first section is actually going to be telling me a little bit about the person that you interviewed. So tell me a little bit about the background of the person, and then share with me any like highlights or insights that you gained from the interview. Maybe something interesting, something unusual, something that needed follow-up, something that you thought was interesting. So that's the first section. The second section of your assignment is you're going to, let me turn the page of my notes. In the second section, you're going to be answering the question of addressing how to elicit, how to get the patient's interpretation of their health status, perceived barriers, support system, things like that. So what are ways that you can draw out those specific pieces of information? And you can include some examples of those pieces of information from the interview that you conducted. The final narrative part of the paper, you will address the effectiveness of at least 3 interviewing techniques. So you're going to critique 3 interview techniques used when taking a health history. And you can get those types of techniques from your textbook, from articles about interviewing techniques. Either one is totally fine with me, but you're going to be critiquing them. And you can also address, this is one that I used during my history taking session, and this is the effectiveness that I found. Okay, so that's how kind of those pieces are all tied together, even though it looks like 2 separate papers. So you're going to have a title page, you're going to have these sections of narrative, you're going to have a reference page, and then you're going to have an appendix. And the appendix is where you're actually going to list out the data that you obtained during your health history. And please remember, this is just a health history, not a physical exam. Okay, so don't give me physical exam findings. Give me information that you elicited from your patient, from talking with them. So you can just outline that. First instance, the first one is identifying data. Patient is a 36-year-old white female who is married with 3 children. You might start out with something like that. When you get down to review of systems, you can just put cardiac, blah, 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 respiratory, blah, 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 GI, blah, 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 blah. Okay, so those don't have to be in paragraph format, whole sentences, just kind of like as if you were conducting a history in the clinical setting. Okay, so title page doesn't count towards the word count. There's no abstract. The parts that are written in paragraphs, that is the part that your word count applies to. Reference page doesn't count towards word count. Appendix doesn't count towards word count. Okay, I hope that helps. Now, part of the outcomes of all of our MSN programs at GCU, we want you to be able to communicate in writing in a clear and concise manner. So, it's kind of like get to the point, just include enough detail, do it concisely, but make it so clear that it can be understood easily. So that's kind of why the word counts are included. And then, of course, we're also going to be giving you feedback about maybe grammar, sentence structure, that kind of thing. But you also have to be able to format those references correctly by APA format. So you may already have it, but I'm going to attach GCU's APA style guide for the 6th edition APA manual. And if you read through that, the first section talks about just composing a paper itself, and I think it's helpful for students. But then the next section talks you about how to format your references. And so hopefully you can catch on to that really quickly if you haven't already. Okay, so yes, I will give you feedback about your writing, your formatting, as well as the content. All right? Okay, so I think that's about it for this week. I hope I answered your questions that you might have about the assignment. But of course, if you have any more, just send me a note in your individual forum if it's something just you want to know. If you think the rest of the students might also want to know, you can post that in your questions to the instructor forum. Or if you're desperate or something that you just really need to kind of talk through, please give me a call on my cell. In the first week announcements is my cell phone number. I do have a full-time position, so if I don't answer right away, leave a message or send a text, and I'll get back to you just as soon as I can. All right? Okay, guys, looking forward to another great week with you, and I'll see you in the main forum.